Good morning and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm licensed marriage and family therapist and a certified sexologist in full-time private practice, along with my colleague, best friend, and business partner for the past 16 years, Dr. Robert Jaffe. We're offering this program to you today at KMET 1490 AM, ABC News Radio.
Indeed, we are.
Indeed,
Welcome.
we are. Welcome.
Welcome, everybody. Today we talk about addictions, codependency, functional and dysfunctional family systems, and trauma. And we're here to help you to learn to understand yourself better, to understand people around you, and the goal of which is to feel more and more connected to your authentic, bless you.
Sorry about that.
That's okay. Your authentic true self.
And it's not COVID.
And it's not COVID, she's hoping. And your authentic true self is born into the world happy, open, free, joyous. We come in very curious. We come in honest. Yes, we don't know how to lie when we come in. We come in sexual. We just learned recently that boys can have erections as early as in the womb, and girls can have lubrication. It's been measured as early as 3 days old.
Yes.
So we all come in sexual. And we all come in trusting. We trust that the world is going to be a nice place and take care of us. And for some of us it is, and for some of us not so much. And so we're here to help you to reconnect to that part of you that can trust and that can love and that can be compassionate with yourself and with others. And so that's what we're going to be doing today. We're going to be talking about different personality components and the roles and the traits of people who come in from families that are not so loving and are more dysfunctional, shall we say. And of course, we want to talk about that because we want to learn if we fit into that or if people around us fit into that. And then, of course, what we can do about it once we recognize that. The goal of psychotherapy is to talk about truth. And the truth is there's the truth in fact, and then there's also the truth in feeling. And facts and feelings can be two different things, but our feelings are our truths. And our truths matter to us, and our truths inform us as to how we should behave and how we should think and feel. And so the more that we can acknowledge our truth and speak our truth, the healthier we become.
Well, that's such a lovely, beautiful, poetic introduction to this morning's program, and thank you for that.
My pleasure.
So with that in mind, we would like to invite our listeners and audience to join us, right?
We do.
So because, this program belongs to all of you, and our phone number here live is 951-922-3532. You may also visit us on our YouTube, Heart-2-Heart.online/YouTube, and soon we're going to be on Facebook Live and other social media, so we'll see about that. And but we sure are trying our very best to connect with all of you, and we would love to hear from you. So 951-922-3532. Please join us, share your questions, your concerns, so that we can all engage in this dynamic of learning about the truth, learning about our feelings, so that we can have a healthier, happier life together.
Mm-hmm. Absolutely.
So, Dr. Jaffe, tell us, please.
So, a lot of what I'm going to be talking about is covered in what we call the Bible of Codependence, which is a book that was written a while back by Dr. Charles Whitfield called Codependence: Healing the Human Condition. And he came up with that title because he realized how widespread codependence is in our society. And so he said, this is something that's actually maybe more common than not in families. And if we can understand it, and if we can look at it without any judgment, but just acknowledging it, the goal of psychotherapy is to heal, of course, and but but we know that we can't heal something that doesn't exist. So one of the great challenges in psychotherapy is to acknowledge, is to move out of denial and acknowledge what is our truth. And our truth, is are the feelings that we experience in growing up, as well as feelings after we've grown up. But the feelings growing up are very powerful because we are born into the world with our right brain, which is our feeling self and our creative self, uh, online. Our right brain is online, and we can feel the same feelings. We just talked about sexual feelings a moment ago. We can feel the same feelings as a baby that we can feel as a 20, 30, 40, or 50-year-old. All those feelings are the same. However, our left brain doesn't come online until later on. There's been debate as to at what point it starts. Some people say it starts around 7. Some people say it starts around 10. Some people say later. But the left brain actually doesn't come online until much later in comparison to the right brain. And left brain is the part that understands logic and language. And so with that part of our brain, we can make sense of what our feelings are. But until that brain comes online, we just have those feelings. And so those feelings are very powerful, as they are in all adults. And when we experience feelings, it informs our behavior. And so we feel something and we act from that feeling, especially before the left brain comes online. So you see babies, acting out their feelings. Whenever they feel uncomfortable, they're crying, right? Whenever they feel jealous of their sibling, they're aggressive. They just act out their feelings. And of course, once the left brain comes online, then we can learn more about what's appropriate behavior and how to treat others. But until then, we are our feelings. And the reason I'm talking about this is because in functional families, uh, everybody's feelings, parents as well as the children, are taken seriously. And they recognize that feelings are very powerful, and that feelings inform our behavior, inform our self-esteem, our sense of self. And so in functional families, those feelings are taken seriously. And that doesn't mean that every feeling is given into just because the person is jealous and tries to take over the toy of the other. Doesn't mean that we say, oh, that's okay, but we help the child understand what they're feeling, and then give them words, even if they can't speak yet. We give them words because they can understand a lot sooner than they can speak how to understand what they're feeling and what the appropriate behavior is.
Yeah.
And so that's something that is done in functional families. I'm happy and proud to say that my daughter, who is also a therapist and has studied child psychology and child behavior, has done a marvelous job with her two twin girls. They're now 2 years old, in giving them words to understand what they're feeling. So if they start acting out and she knows that they're probably hungry. She'll say, "Oh, honey, are you hungry? Maybe that's why you're not feeling so good. Would you like something to eat?" And then she'll offer them some things to eat, and then she'll see, based on their behavior, whether they respond positively to that, if she's right. And if they're not, then she'll take another guess until she hits on what it is that they're feeling and why they're acting the way they're acting. And that's totally different than in dysfunctional families, which they're I'm not going to say ubiquitous. They're not everybody comes from a dysfunctional, but they're very common. And and the reason that they're common is because of evolution. We are evolving into human beings, but we have been instead part of the human species where it's all been about me. And as we evolve, we realize that there are others in the universe. Now, of course, you say as an adult, well, of course we know there are others. However, we don't really know that because at a feeling level, it's all about me until the left brain starts to come online, until they can understand things. And so when people don't recognize that they are not always the center of the universe, they act out in ways. And because of evolution, we have learned just to look at the behavior rather than the feelings that inform the behavior. And the behavior is either rewarded or punished, and that's pretty much the way we have lived in our society. That it's all about behavior, and people are like, "Oh, that's bad behavior. Oh, that's good behavior," without really understanding the motivation and the ideas that are motivating the person, so that we can instruct the person in what they're feeling and how to handle those feelings differently, rather than just reward and punish the behavior.
Okay, well, that's just such a comprehensive opening.
Okay, well, thanks.
As you were talking about the left brain and the right brain, I remember that this book that is called The Master and His Emissary by
Ian
Ian
McGilchrist.
Yes, thank you, Mike Gilchrist. Thank you. So there is a table at the very beginning part of the book that actually, compares the left brain function and the right brain function. And it's so interesting to see the contrast, between the two parts of the brain, and how left brain is in charge of something, and then the right brain, uses, its own function of
30 seconds.
I like to for us to go over that table.
I think it's important.
It's important,
Yeah,
right?
yeah.
So then let's do that after our commercial break. We just got the notification that we have commercials coming up. So we look forward to see you back with us after commercial break. And don't forget to call us, please, 951-922-3532. And look forward to hearing from you.
And pay attention to the commercials because we're on them. Bye-bye.
Welcome back from our commercial break. Dr. Mitra and Dr. Robert here at KMET 1490 AM ABC News Radio at Heart-to-Heart program. For those of you who are just listening to us, we are talking about codependency, addictions, trauma, relationships, and anything that falls under that huge umbrella of life. Please call us at 951-922-3532. And you can also visit us at our YouTube at heart-2-heart.online/YouTube. Soon we're going to be on Facebook Live. And you can also email us your questions if you don't wish to, talk on over the phone on the live program, which we encourage you, of course, because your question will help other people experiencing similar situations. Any way that you can connect to us, you're more than welcome to do that. 951-922-3532. So, Dr. Jaffe.
Yeah, we were talking about how we're born with our right brain intact, but our left brain doesn't come online until later in childhood.
Probably age 5, that's where it's gonna start to show up.
Well, again, what I say is there's debate on that. But certainly years after we come into the world, it doesn't happen in days, weeks, or months. So our right brain is totally functional, and so what we are our feelings, and we pick up all our information through our feelings and through our bodies, without our ability to cognitively understand a lot of what's going on. And you were going to talk to us about some of the left brain functions and the right brain functions so that people can understand a little more of what we're talking about.
Right. I mean, it's very interesting, contrast here. So I'm going to go from left brain function to right brain function. So when left brain function uses logic, right brain uses feelings.
Mm-hmm.
Right?
Mm-hmm.
Left brain is detail oriented, versus right brain, which is big picture oriented.
Mm-hmm.
Left brain is facts and rules, and then right brain is imagination rules, right?
Mm-hmm.
Left brain is words and language, versus right brain, which is symbols and images.
Mm-hmm.
Left brain is present and past, right brain is present and future. Left brain function is about math and science, and right brain function is about philosophy and religion.
Mm-hmm.
Left brain can comprehend, right brain says can get it.
That's good. I like that one.
Yeah, I really like that one. Did you get it?
Yeah.
And then we see that in couples, why can't you just get me?
Yeah,
right?
Yeah, exactly.
So that's the right brain talk.
Mm-hmm.
Left brain is about knowing, and versus right brain, which is about beliefs. And left brain is about acknowledge, and then right brain is about appreciates. So left brain is about, it sees orders or patterns, whereas right brain is spatial perceptions. Left brain knows object's name, right brain knows object's function.
Mm-hmm.
Isn't that interesting?
Mm-hmm.
Left brain is about, reality based, versus right brain, which is fantasy based.
Mm-hmm.
Left brain forms strategies, whereas the right brain presents possibilities. I like that very much too. Left brain is practical, and right brain is, how do you pronounce this word? Impetuous?
Impetuous, yes.
Yes, impetuous. Left brain is safe, versus right brain, which is risk-taking.
Uh-huh.
Now, reading this, I'm definitely, far into the right brain function than my left brain function. I mean, there was a time that actually I was primarily a left brainer. I can see that. And now, no, I'm in the right brain. Not that I forgot my left brain, but I guess I'm more of a right brain functioner now.
Yes. I think, and when you were an electrical engineer, that of course is left brain functioning.
That's left brain functioning.
And I think that's why you decided to get out of that field, because it wasn't really satisfying you because you have such a powerful right brain desire as well as capability.
Oh, thank you.
Well, true.
Yeah.
And so it was unsatisfying because you were.
Yeah, it was. I remember how I got out of that field one day as I was sitting behind my desk, and I was just working, on my PC board, and I was just trying to, connect all those components together and all of that. I suddenly said, what am I doing?
Mm-hmm.
I said, what am I doing? Am I going to look at this PC board for the rest of my life and just do different soldering, do different wiring, do different components, and then come up with a software that's going to be obsolete as soon as I'm done with it? Because that's how fast technology worked at that time, right?
Yeah.
And then I said, so what am I getting out of this?
Exactly. Exactly.
And I just suddenly felt so bored, suddenly felt so out of place, suddenly felt, this isn't me really. Even though I'm doing a good job, it wasn't me. And everybody, when I said, I'm quitting my job, everybody thought I have lost my mind. A female engineer, electrical engineer in early 80s. Are you kidding me? That was a huge deal.
Yeah, yeah. Yeah.
But I'm glad I did it.
And I had not the same experience, but a similar experience because I went to law school.
Yeah.
And law school is definitely a lot of left brain stuff.
Right.
And I didn't complete. I went for 2 out of the 3 years, and people said to me, "Hey, you completed 2 years. You've done the hard lifting. Why don't you complete the 3rd year?" And I said, "No, I've already learned what I needed to learn, which is I don't want to practice." And so I didn't even know what I wanted to do at that point, but I knew that it wasn't for me. And then going back to school to become a therapist, I recognized, oh, this is using a lot of the right brain. This is using a lot of the feelings and a lot of the big picture stuff.
Right.
So yeah, so it was definitely a good fit.
Yeah, not only it was a good fit for me as well, because one of the other things, the right brain function that I did, the use of images and imagination and all of that was my painting, right? So when I brought, painting and psychotherapy together, I found my niche. That was it. It was felt so right.
Yeah.
And through today, every day that I'm doing this work, I don't feel like I'm working. Because I love it so much.
Yes.
It is like I'm made to be this.
Yes. Exactly. Perfect fit.
Yeah.
So we're going to talk now a little bit about, okay, so in a functional family, the feelings of each individual, including the children, are very, very valued and important. And the behavior is not overlooked. It's not, some people say, well, you can't walk around in the world just, having feelings and not attend to behavior. And of course, that's true. You can't do that and succeed. But what people don't recognize is that feelings inform behavior, and that even when you have a feeling is just energy that has meaning attached to it. And so your feelings are your intuitive way of knowing things. And if that part of your brain has been suppressed, which is often the case in dysfunctional families, they suppress that feeling part of the brain because all that matters is behavior. And when all that matters is behavior, the person then doesn't feel complete. And yet, as children, we have to fit into the family that we're in because we're totally dependent on them for our physical survival.
Yes, and that's why, during the first 5 years, because we are basically feeling oriented, little human beings, right? It's very easy to get hurt.
It's very easy to get our feelings hurt.
Yeah.
And when people give us messages such as, I've even heard parents say to their children, "Grow up." That's no big deal.
Right.
When they're disappointed, let's say, when they can't have the piece of candy or the ice cream that they want at that moment, or knock it off, or that's enough,
or you're a boy, you don't cry.
Or stuff like things like that where people are giving the parents are giving direct messages to the children that tells them that they're not okay for having that feeling and they're not okay for expressing that feeling. The child learns quickly that where their bread is buttered, so to speak, that they can't do that. And so they have to make sense of why they can't do that. And then they have to feel like gain the parent's favor because the parent can withhold food, the parent can withhold privileges, the parent can punish the child physically or emotionally, and the child knows that they're totally vulnerable, so they feel as though they have to fit in with that parental system, and they're right. They have to fit
Right.
in. So when you have to fit into the parental system rather than the parents understanding you and helping you understand yourself, you take on certain roles. And in the book that I'm talking about, Codependence: Healing the Human Condition by Charles Whitfield, he identifies 15 roles that people take on in dysfunctional families. And the roles that you take on in dysfunctional families in order to fit in and be approved of by the parents are very powerful, and they can last a lifetime. And they do last a lifetime until and unless they are revisited and understood as to why they were created, and then the person makes a decision to unlearn them and learn something else. And so the obviously we're not going to have a chance to go through the whole 15 today, but we can begin. And so one of the roles that people take on is the role of the rescuer and the fixer in the family. Um, and so what that person does is they try to rescue or fix or help other people. And what's the cost of that? The cost of that is they neglect themselves, right? So these are people who lose their identity to other people. And if you lose your identity to the other person, that's the beginning of codependency, right? The old joke, which is not that funny, but the old joke about codependency is when you go to bed at night with a codependent, you wake up and you say, "Good morning, how am I?"
Right.
Right? And it's cute, but it's not that funny because it's all too true that we lose our identities, and so we believe we are who other people believe we are. And so these people can also become chameleons, where they change their shape and they change their color based on who they're with. And if you are one of those people, or if you know someone who is, uh, any of these things coming from a somewhat or a lot dysfunctional family system where the behavior was punished or rewarded without any attending to the understanding of why the behavior was happening. And so the person, if it's you, you deserve your own compassion, meaning that you went through a difficult time and you learned to cope with it in the best way that you could.
Yeah. One thing that, as I'm listening to you, it reminds me that, you know, uh, many people can actually experience this particular characteristic that you just mentioned.
Mm-hmm.
And when that happens, it doesn't mean that the individual is codependent. However, if it becomes a way of life,
Mm-hmm.
then that's where the issue is,
Mm-hmm.
right?
Right.
Because many of us at some point we want to help, we want to fix, we want to alter, we want to be there, and that's not codependency by itself,
Right.
right?
Well, yeah, it codependency, of course, is about the relationship,
Right,
right?
right.
So that the person can manifest these symptoms of being the rescuer or the fixer, um, and that doesn't mean that they are in a codependent relationship,
Right.
right? But if they have those qualities, and those qualities are manifested in a relationship, it can be it can easily become codependent.
Yes. Yeah.
Yes.
Exactly.
Yeah.
Yes.
So people who do this,
Because I don't want people to get the impression, okay, I'm no longer going to help. I'm not no longer going to fix. I'm
right,
no longer going to do that.
right,
No,
right,
no, that's
right,
not what we're saying.
right.
Right,
When we say a rescuer, what we're really saying is we're trying to rescue other people from the consequences of their behaviors, and also perhaps rescue them from unpleasant feelings.
right. For example, if a husband, comes in with shoes that has dirt on them, and so it's so oblivious on that, and the wife goes immediately and cleans up after him without telling him, please don't walk in with your shoes full of dirt,
Hmm.
right? So that's the codependency we're talking about.
And
30
that's
seconds.
Yeah,
and yeah, and that's codependent, uh, because you're taking care of the other person in a way that is enabling them. You're
right.
enabling them to not take care of themselves, and
Exactly.
to not do what is their responsibility.
Exactly.
So we
Right.
just got the notification that
Right.
we're about to take another break. We will come back to this fascinating topic, and we want you to call us or email us or do something to let us know that you're alive and you're out there. So
So 951-922-3532.
we'd love it. We're here waiting. Talk to you later.
Welcome back from our commercial break, Dr. Mitra and Dr. Robert at KMET 1490 ABC News Radio, Heart to Heart program. During commercial break, Dr. Robert and myself, we had a very funny episode about our own way of codependency here at the office, which was really fun. So anyway, it would have been nice to be on live, but
That
it
would have been
didn't.
good. That would have been good. We
Right.
talk, yeah. Um,
So we're going back to
Going back to, yeah. So
characteristics of codependency.
characteristics, right? So
Right.
we just talked about the rescuer. Okay. Again, these are characteristics. These are survival mechanisms
Right.
that children adapt to and adopt in order to fit in or to make things go smoother in their family when the parents are having trouble, and the child feels unsafe. So the child adopts a stance. So using the rescuer and fixer identity, they are going to help the parent get through the difficult feelings, or they're going to do something to make the parent feel better. Let's say if the parents are in a codependent relationship, and or an addictive relationship. An addiction usually equates with codependency. There's usually addiction and codependency usually come together when people are in a relationship. So let's say if the man had drank too much the night before, the woman will call work and say, "Oh, he's sick," right? And so that's a codependent stance because he's not taking responsibility for what happened, and she enables him to do it. We will get into enablers at a later time.
Right.
Yeah. So these are all things that people do in order to fit in and to feel safe in a family that isn't attending to the child's emotions, but only focuses on the child's behaviors. The child begins to think that they are their behaviors, and then neglects their own emotional world, their own emotional life. And your emotions are there. It's sort of like, I like to analogize it to the rudder and the motor
Mm-hmm.
of a boat, right? So uh, the motor gets the boat moving, but the rudder tells which direction. And so we need both the left brain and the right brain in order to move in the direction that we want to move. And feelings inform us as to what's most important, what direction to move in. And our intellect can then tell us how to get there. Yeah.
Right.
Yeah.
So we're not saying left brain, is a problem. No, I mean,
No.
but it has a different function, and people can become a left brainer, or they are also can become a right brainer, or they can have a balancing between the two.
And interestingly, and I know you'll like this statistic, it's been shown that women have more of the ability to connect both left and right brain.
Right.
It's part of the physiology of the woman that they can connect both of those, whereas men tend to be one or the other. But in general, men are more left brain.
Right.
Yeah.
So why would I like that more?
Well, because you guys have it more together.
Oh,
You've got the two parts of the brain that work in conjunction.
And that's a new discovery?
That's well, it's new for the listeners. It's not new for us
well,
because
I
we've
don't know.
we
Human beings have been living in this earth for how many billions of years?
well, but men
Did we
men
just
men
find?
men like to think that women are all emotion.
Right.
And what I'm saying is that isn't accurate. That isn't
Right.
accurate.
So for
Yeah.
all the men who are listening there, and that has been their beliefs, we
Yeah.
have bad news for them, right?
Exactly. So now the second one, and I mentioned there are 15. We're only going to get through a couple of them today.
Right.
But the second one, and this will be no news to people, but it's very, very common, is the role of the people pleaser, right?
Exactly.
Yeah. And the people pleaser, that person doesn't have healthy personal boundaries and limits, and they would rather acquiesce and comply with other people than express their own healthy wants and needs. And these are people who have a very hard time saying no to other people, right? And so part of their recovery includes learning how to say no, but it's not just learning how to say no, it's learning how to say no without feeling guilty. There's actually a book on that, and that's the title of the book. A book that I haven't read, but I came across, which is called "When I Say No, I Feel Guilty." That's the name of the book.
Well, that's a pretty powerful one.
Yeah, yeah. I mean, that was a great title. I don't know if the contents live up to the title, but we're talking now about the problem in saying no is not that the person's mouth isn't working right and they can't verbalize the word no. The problem is that they feel guilty when they say no.
It is as though they are doing something bad.
It's as though they're doing something bad, and also as though the other person is going to get angry with them.
Right.
Yeah. And that obviously could have happened to them in childhood, or they could have observed that happening in between the parents, that if one person would disagree with the other person, they would end up into a fight, right? And so they observed that, and so they learned, oh, it's not okay to disagree with somebody. So, and since I'm the child and I'm totally dependent on them, I have to go along with whatever they say. And people, and so parents who have an authoritarian belief about child rearing often get into that place where as long as you're under my roof, young man or young lady, you will do as I say. And so they're authoritarian and they're demanding and they're commanding. And the other person, because they are dependent, feels forced into doing it. But because they feel forced into doing it, they have resentment. Because anytime you're forcing somebody, that person is going to feel resentful.
Right.
And that resentment usually comes out in one of two ways, or two of two ways. Either the person rebels secretly, and so they do something when the parent isn't looking, and or they do something which is self-sabotaging.
Walking away.
Well, yeah. They.
Right.
What do you mean walking away?
Like leaving the house. I have seen it. They say, unless you as long as you're under this roof, you do as I say. And then children said, okay, so I'm not going to live here anymore.
Oh, so so that's rebelling. Yeah.
Yeah.
Or and so the child could leave the house, let's say run away at 14, 15, 16
Yeah.
years old.
Yeah.
And then of course then they then they're out on the street and they're very vulnerable to predators.
Exactly.
Right.
Yes. Yeah.
So people pleasing, and this is not ubiquitous again, but it's very, very common in families with who have authoritarian command styles. And people who are people pleasing do carry a lot of fear and guilt about when they do rebel, or when they do say no to other people. So they generally learn to comply, and in as they comply, the other person then feels more and more like I can control them. And so they end up in relationships of one person controlling, the other person acquiescing, uh, but the person who's acquiescing feels more and more resentment, and therefore acts out that resentment subconsciously in ways that are detrimental to themselves or to others.
Exactly. These are some of the very common behaviors that we see in couple therapy, that how one of the couples becomes a pleaser or becomes a rescuer, and then they don't even see how that this is happening. They think that's normal. But ultimately what it does, it damages the relationship, and then puts them in one up, one down kind of position without even realizing.
Exactly.
And they say, I'm so good to him or to her. I do everything for him or for her. I just, he's the love of my life, or she's the love of my life. But they don't know that how that codependent behavior actually is the disrupting factor in their relationship.
Right. And so what I want to say about this is all dysfunctional families uh, affect people in terms of helping them disconnect from their authentic true selves.
Exactly.
Because a lot of our authentic true self has to do with our feelings. If I feel validated by you, if I feel seen or I feel like you get me, to use the word you used earlier, um, I don't need to adopt another stance. I don't need to not be myself.
Right.
I can express the truth of how I'm feeling at the moment. And when we do that, then we're connected with our authentic true selves. And if I can express the truth of my feelings, and you can express the truth of your feelings, we develop more intimacy, we develop more understanding of each other, and more closeness.
Yeah, and that's the key word, understanding. And yesterday we talked about understanding in the other program we had on Thursday afternoon. And understanding is such a significant and area of living together, right?
Yes.
And understanding, like we said it yesterday, doesn't mean agreement, doesn't mean acceptance, but simply getting where the person is, where the other person is.
Yes. Yes. Understanding means getting the loving comment from one person to another is, yes, I see what you did, and what you did was hurtful, but I also understand why you did it.
Right.
See? And when you give that message to somebody, the person goes, oh, yeah, I can see now, because it is they're not just judging me on my behavior. They're getting to a deeper level where they go, oh, you understand. Tell me how you understand. And then if the person can express how they really get the other person, then it leads to a productive conversation. And then the other person can safely look at their behavior and go, oh, that's why I did this, but I can understand now that it was that I was having that feeling, and that feeling motivated me to do that, and I'm not going to beat myself up for it, but I'm going to learn from it so that I don't have to do that hurtful behavior again.
Right, exactly.
Yeah. The next one that we're going to go to, and it'll probably be the last one for today, is overachievers. Right?
Yes.
And overachievers overachieve, meaning that it's close to perfectionists, but it's not quite the same, meaning that they have become their behavior, and so they think that everybody is judging them based on their behavior. And so their behavior has to be excellent in all
Yes.
areas,
Right.
because if it's not excellent, and if they forget to cross the T or dot the I, they're going to be called on the carpet, you see. And so they feel like, okay, I need to I need to show other people that I'm excellent, so that I'll be free from criticism. And what that does, of course, is it alienates them again from their true self,
Right.
right? Um, because we don't need to prove ourselves if we are confident that our true selves are lovable and competent.
And that's, the point that I've seen people that they are overachievers, and that overachieving can actually get to perfectionism and some level of OCD, which only anxiety, provoking. And when you look at the people like that in their childhood, you see the neglect, you see abandonment, you see,
Mm-hmm.
emotional and physical abuse,
Mm-hmm.
right? You see small t and large t trauma significantly. So by becoming overachievers, they're actually trying to show that I'm so good, come and take me and love me.
Right. Exactly.
Simply is that
Mm-hmm.
the love that they didn't get during their childhood, now by overachieving, they try to sell themselves as lovable people.
Correct. Correct.
Right.
So overachievers, uh, underneath the overachievement, they feel a disconnection or an emptiness, because they're not connected with their loving, authentic, true self. And what they do is they try to fill that emptiness up with achievements.
Right.
We have 30
And so,
seconds left.
and so, because the emptiness was not due to a lack of achievement, it's a futile thing. You
Right.
cannot fill up that emptiness with overachievement.
Right. All you need is love.
All you need is love.
Yes.
And so what we do in therapy is we try to help people reconnect to that loving, authentic, competent part of themselves, so that they don't feel the need to continue their overachievement. And then as they do that, that they can recognize when other people are in their authentic true self, or when other people are judging them based on their behaviors.
So we need to continue with this amazing, discussion next week. Don't forget to please join us on Thursday at 3 and Friday at 9. And until then, all you need is love.
All you need
Thank
is
you
love.
for listening to us.
See you next week.
The preceding was a paid program. Views and claims expressed are those of the program producer and are not endorsed by this station. Opinions expressed are not necessarily those of radio station KMET